And there were other even bigger child killers, measles and others. But for some reason, for me personally, the absolutely unnecessary and kind of heartbreaking suffering from tetanus always stuck with me, and particularly because of this image that UNICEF shared, which was that parents would think that their tiny newborns were actually smiling for the first time. But it was actually the muscle spasms that were the precursor of full-blown convulsions and death from tetanus. And that was for one of like 60 cents worth of vaccine. And to me, this was a kind of embodiment of the structural violence of poverty manifesting as the lack of access to even the most basic health services. And we've had the tools for more than 30 years to keep those kids alive, but those tools were out of reach for so many families. So in the mid-1980s, a group of everyday people coming together through Results were instrumental in the creation and funding of the very first U.S. programs to help countries scale up child survival. Interventions like vaccines, inexpensive antibiotics, vitamin A capsules, really basic stuff. And then a few years later, in the kind of mid-1990s, a conservative Republican from Alabama named Sonny Callahan took over as chair of the kind of key committee in Congress that oversaw the foreign aid budget and all of these issues. And this was a guy who had never, before he came into this role, had literally never voted for a foreign aid bill before. So we were very nervous about him coming on. But we also saw it as a kind of interesting opportunity. So some of our Results folks, myself, but also our Results volunteers, talked to some of his colleagues and asked them to kind of pitch him to take on this issue of child survival. And they did, and he took it on. And so Results volunteers here in Houston and Austin and around the country got 30 or 40 other members of Congress every year to write this guy letters and speak to him personally, asking him to make these issues a priority so that he understood that this was not just his priority, but it was Congress's priority and the country's priority. And just a few years later, Sonny Callahan and Nancy Pelosi from California, as far apart politically as two people about could possibly be, they came together and created and then expanded this special child survival account in the foreign aid budget that protected those programs and expanded them over 2 decades. And a few years after that, when Sonny Callahan actually stepped down from being chair of this committee, he was on the floor of Congress and he said, not only was this the single issue that he was most proud of, but it was the one that he got the most support from his allies, from his colleagues in Congress. And this was in a foreign aid budget that included Egypt and Israel and, at that time, the drug wars and, funding for Colombia and other things. And yet that was the issue that he felt he'd gotten the most support from. And I know that was because of Results volunteers around the country building that support for their members of Congress. And as you heard from some of the Real Change folks, just last year we launched a campaign about this time last year with all of our international partners to push the world's wealthy governments, including the U.S., to provide $7.5 billion for Gavi, the Vaccine Alliance, which is a mechanism that supports poor countries to vaccinate their kids against the biggest killers. And at this time last year, we were told pretty unequivocally by the Obama administration that we would never get the $1 billion that the U.S., which was the U.S. pledge that we wanted from the U.S. as a leadership pledge for Gavi. But fortunately, we didn't listen to that. And in the U.S., our volunteers garnered over 200 pieces of media, and we mobilized a quarter of the entire U.S. Congress to weigh in with the administration in support of Gavi. And in terms of the media, that included media in the Austin American-Statesman, the Dallas Morning News, the Galveston County Daily News, and the Houston Chronicle. And in terms of, it's not a competition, but in terms of just the success that the Texas folks had, they actually mobilized a third of the Texas delegation to also weigh in on these issues. And if you want to have a bit of a sense of the kind of activism that it took, you saw Casey Waters, who was just up here a minute ago. Around this time, in the midst of this Gavi campaign, Casey was in a very bad accident. But when it came time training call for advocating on this for the next stage of the campaign. She actually took that call literally from her hospital bed to be able to advocate on this. And in the end, the U.S. administration did make that 4-year, $1 million pledge to Gavi, and that $7.5 billion that we were seeking from all of the countries in the world was not only achieved, it was actually exceeded. But I really want to emphasize that $7.5 billion isn't just a dollar figure. That money will help poor countries vaccinate an estimated 300 million children between now and 2020. That's going to save about 5 million children's lives and really, frankly, protect the health and the quality of life for tens of millions of more kids. And since we started our advocacy on child survival 30 years ago, the scale up in basic vaccine programs has reduced neonatal tetanus by a staggering 94%. And that 41,000 a day number that I talked about has been slashed by more than half to 16,000 a day. And that's even as population has increased by 50%. So that's still way too many kids, but it's also amazing progress. You know, and this is in part a story about science and technology and medicine, but it's far more a story of committed advocacy, making sure that the world does what it takes to make that technology and those medicines available to the kids that need them most. And because of what we've collectively achieved over the last 30 years, the platforms we've built and what we've made possible, we're now actually in a position where we can end preventable maternal and child deaths in the next 20 years, if we choose to do so. That really means for the first time, literally for the first time in human history, we're within sight of a future where a child born in Tanzania has the same opportunity to reach her 5th birthday as a child born in Texas or Tennessee or other places. And you know, people like Dr. Hotez are playing a key role in helping us get there. Frankly, the Obama administration has made some significant commitments to get there as well. And Results volunteers are helping make sure that those commitments are met. Right now, we're working on a really interesting piece of legislation with key members of Congress that's going to ensure that our investments in child survival are even more effective, so that they fund the things that are proven to have the highest impact, and they reach the places and the people that are most in need, so that every single dollar is going to have more likelihood to save more lives. And it's called the Reach Every Mother and Child Act, and very interestingly, again, we've got this quite great bipartisan support, and that includes folks like Barbara Lee in California, if you know Barbara Lee, quite probably one of the leading progressives in Congress, and Michael McCall from Austin. So it's a broad spectrum of bipartisan support, and both of those folks were original sponsors on that bill. And we're continuing to build not only strong Democratic, but also Republican support. So nobody wants to see kids dying needlessly of things that are preventable and treatable. But child survival is really just one of the areas that we've worked on in the last 35 years. Here in the U.S., we've pushed hard on key tax policies that are having the biggest impact on moving low-income families out of poverty. Except for Social Security, the Earned Income Tax Credit and the Child Tax Credit are the two most important things that move and keep people out of poverty in this country. We've also worked to prevent cuts of billions of dollars to SNAP, what used to be food stamps, which is, again, the most important and effective program to prevent hunger in this country, but also a really important anti-poverty program. We've helped secure access to education for the most vulnerable kids on the planet, and we've reduced the number of kids out of school by half. We've helped ensure microfinance when we started working on these issues, small loans for very poor women in particular to start their own businesses. When we started working on this 30 years ago, there were maybe less than 1 million women and their families accessing these loans. Now it's well over 100 million of those families accessing these loans and being able to move their families out of poverty. And we've also been part of one of the most radical success stories in modern history, the global fight against AIDS. You know, in 2000, again, 15 years ago, there were only a few 100,000 people around the world on AIDS treatment in low and middle income countries, even as you guys all know, these epidemics were absolutely devastating Africa and Haiti and other parts of the world. When we started working on these issues, a colleague of mine left being a physician working in Lusaka, Zambia, and became an advocate on AIDS because the fastest growing business in Lusaka, in the capital, was making coffins. And he couldn't bear that, and he felt like being a physician, he wasn't having enough impact. So we helped advocate to create new mechanisms like the Global Fund to fight AIDS, TB, and malaria, to help massively scale up these programs. And this summer, 6 months ahead of schedule, the world reached the goal of putting 15 million people on AIDS treatment around the world. So that's 15 million from a few hundred thousand, and the cost of AIDS drugs has been driven down from $10,000 per year to less than 100. So that's a 100-fold increase in treatment and a 100-fold decrease in costs. And now, because of this, and because of what's been built, we're actually poised to defeat AIDS as well as the epidemics of tuberculosis and malaria. And I think you'll hear from Dr. Hotez in a moment about some of the other neglected tropical diseases where we could put an end to this stuff if we just made a decision to do so. Not incremental progress, but ending them. And ending these epidemics, ending preventable maternal and child deaths, and even ending extreme poverty. And the work we're doing is not just about ending the bad stuff. It's about what that makes possible, not just survival, but the ability for kids to thrive, and the ability for people to have access to the basic services that give them a future. But we have to be really completely clear that all of this is possible, and none of it is guaranteed. This is a genuinely, hugely pivotal moment, in this country, in the world, and kind of in the history of what we can do. But pivotal moments are called that for a reason, because they can pivot either way. There is no guarantee that we have here. These things will only happen in our lifetime if we make sure that what is possible is also a political priority. And that's really what Results is all about. And that's why we're so committed to growing our grassroots to all 50 states and a whole bunch of additional key congressional districts. It's why we're growing internationally. In just the last year, we've expanded the Results model in Kenya and Zambia and South Korea, and we aim to expand a lot more ambitiously in the next 5 years. As I mentioned earlier, just last week I was in Kenya, and I had a chance to be in Nairobi and get to spend a day with our Kenya partners who are using the Results grassroots model. I don't know how many of you are familiar with Kibera, but Kibera is an informal settlement on the outskirts of Nairobi. It's actually one of the largest urban slums in the world. And it's a place where most people live on less than $1 a day. But our Kenya partners have actually built a network of 200 women in Kibera who are now advocating with their members of parliament and their local representatives to make changes, locally and nationally that will put an end to that kind of poverty in Kenya in the future. And they have a broader network of activists really across the country who I had a chance to meet. But again, among the most inspiring were these women in Kibera who had so little themselves, but were using their political voice to change lives for themselves, but for their whole community. So again, to all of you who support Results, I want to extend again an enormous thank you. You genuinely make our work possible. Your contributions are really the most precious resources that we receive. And it's your support, your kind of unrestricted support that we get that really lets us to drive our campaigns, to do our domestic expansion as well as our international expansion, and support our real change young leaders. And I want to close with just a quick story about another former Real Change fellow from Houston. And 18 months ago, Min Yuan never spoke to a member of Congress or their staff. And he tells the story, some of you may have heard it, he tells the story of being so nervous the first time he met with a member of Congress that he was literally physically shaking. But he kind of moved his way through that, went through this meeting with the support of the Results leaders in this room, and got totally hooked. And he then went on to have 12 face-to-face meetings with particularly his member of Congress, who he, I would say, in a very positive, kind of friendly way, was almost stalking, but very successfully, but had 12 meetings within that number of months. But Min isn't here tonight, and that's because this fall he moved to New Hampshire in the lead up to the presidential primary as part of our new Election Fellows program. And so he's following candidates on both sides of the aisle and working to get them to be champions on the end of poverty. So since August, I had to make the list here. He's talked to Marco Rubio, Hillary Clinton, Jeb Bush, John Kasich, Ben Carson, Lincoln Chafee, Bobby Jindal, Chris Christie, Carly Fiorina, Donald Trump, Bernie Sanders, and Lindsey Graham. So, I would just say it's safe to say that the next president of the United States at least has very likely already heard from results. I mean, I think it's such a great example of what we do, and frankly, the energy of this new young leadership, supported by people that have been doing this work for 20 or 30 years. So I just want to end by saying, we know it's possible to end poverty. And with people like Min and the young leaders that you met in this room and the results leaders that have been part of this work for 20 years, and all of you, I also know that we will do this. It's not just possible, we actually will do this. So thank you for your partnership. It's wonderful to have you here tonight and to get a chance to talk to you. And I look forward to creating the future in the world that we all want. So thank you.